vital strategies to help manage your health and side effects of medications.
Do you want to just let them know how to get to the slides?
Do you have the slides with you? They are on the same. There's a pin. There's a paper clip, a symbol. If you click on that, you'll be able to access the slides. Could you confirm once you have them, and then I'll start speaking? Perfect. Okay. All right. So the slides are numbered, and I'll go through the numbers as and when I go through the slides. So, to slide number 1, the objectives of the talk would be to overview the factors that increase the risk of heart disease in patients with mental illness, and to see what how to treat and manage these risk factors to improve the outcomes. So, to go to the first objective first. What is commonly seen in patients with mental illness is that over time they end up losing 2 decades of life. The two pictures on the slides, in slide number 2, are that of Albert Einstein and his son Eduardo Einstein. Now, Albert Einstein, as you know, was a world-famous physicist, and they were pretty well off, so it was not resources. But then his son developed schizophrenia, and even though he had the access to the best of medical and psychiatric care, Einstein died at the age of 75 years. His son, however, died at the age of 55 years due to heart illness and related causes. So this is just to show you an example of how clients who develop mental illness and are on medications can sometimes lose up to 2 decades of their life due to a combination of factors, and we are going to discuss some of those factors today. To summarize, patients with severe mental illness lose about 20 years, and this is largely due to an increase in the risk of heart disease. The pathway from mental illness to illnesses such as diabetes, obesity, metabolic syndrome, which eventually contribute to increased risk of heart disease, is not a simple one, in that there are multiple factors that influence this risk. So there are lifestyle, on slide number 4, if you have them, there are these lifestyle factors which are often seen in clients with mental illness, which include poor physical activity levels, poor dietary habits, poor self-care, and high smoking rates. All of these factors don't apply to all the clients, but these are some of the things that are seen commonly in clients with mental illness as a group. There are also system-level factors, and these are factors that healthcare professionals themselves and systems they work in are responsible for, and these are reduced access to physical care. Often, clients with mental illness get labeled as mentally ill, and oftentimes physical care is not afforded to them as commonly as it would be for someone who does not have mental illness. Also, mental illness and physical illness, the care for them are not as well integrated in our system as one would like to be. There are also policy level ambiguities which make these problems worse. Then there is illness biology itself, by which I mean that the same risk factors that predispose someone to develop a mental illness also predispose them to develop metabolic problems. And these factors operate at genetic levels and upwards. So there's very little an individual can do to target these biological processes, except using some interventions that we'll discuss later in the presentation. And then, of course, there are treatments that one needs to treat these mental illnesses, and yet some of them have certain side effects which can increase the risk of heart disease. And among them, antipsychotics seem to be ones that stand out because of the ability to cause weight gain and related metabolic problems. So if you come to slide number 5, there are these new class of antipsychotics. Most of the clients now are on these drugs. These include drugs like olanzapine, quetiapine, paliperidone, etc. They are an improvement over the older drugs like haloperidol, because some of the side effects that we saw with older drugs do not happen with them. So much so that we don't see them as often in clinical practice. However, they have their own side effects, some of which we discussed earlier, which include weight gain, decrease in the effectiveness of insulin in the body, which is called insulin resistance, and cholesterol-related abnormalities. Now, it has been shown that schizophrenia by itself or psychosis can, just by having psychosis, the risk of diabetes increases by 3 times compared to people who do not have them. And then being on treatment for this increases the risk by a further 3 times. And antipsychotic use in the youth has been associated with a 2 to 3-fold increase in type 2 diabetes. Again, whenever we are discussing this, I must remind you that it is not to say that antipsychotics should not be used. Antipsychotics are the principal treatment for psychotic illnesses, including schizophrenia and bipolar disorder, and their use is inevitable, except that we have to remember that some of these side effects are important to handle as well. So how we handle them is by being proactive and by knowing that these side effects can occur, and to handle them as and when they become apparent. And we'll discuss that later on in the talk. So what happens with these medications sometimes is that the fat distribution in the body, the amount of fat in the body changes, and the weight is distributed also changes. So we have two basic kinds of fat in our body. One is called the subcutaneous fat, which is under the skin, and then there is something called visceral fat, which is in between and around the organs of our body, like liver and kidneys, etc. Now, it has been shown by research that visceral fat contributes to increased risk of heart disease. And some of these antipsychotic drugs actively increase the amount of visceral fat in the body. Other than cardiovascular problems, weight gain and metabolic problems associated with drug use can lead to problems with compliance, with self-esteem, because, well, if somebody's weight increases significantly, they are less likely to go out, mingle with friends, and overall this creates a cycle which ends up with increased hospitalization rates, poorer quality of life, and generally increased social care costs. So these are all sort of downstream effects of the weight-related problems that some of these drugs cause. It has also now been found that having these problems, weight increase, diabetes, high cholesterol, etc., can also lead to worse brain functioning, which is a problem because schizophrenia and other psychotic illnesses themselves have reduced brain function. So this can potentially make the problem worse. On slide number 10, if you see now, there's a special drug called clozapine, which not every client is put on, but it is a drug of last resort in many manners, in that when patients don't respond to other antipsychotics, clozapine can be started. Now, this is a wonderful drug in that it helps those patients who do not respond to these medications, but then it can also cause significant weight gain. It's one of the antipsychotics that causes the most weight gain. And it is a problem because the use is often unavoidable and ongoing because no other drug seems to work, but then it causes these side effects. So then we need to know how to handle these for the best outcome possible. So to summarize the first part of the talk, individuals with mental illness are at much higher risk of developing weight and heart disease related problems. The antipsychotic drugs which we use, they target some psychotic symptoms, but they don't solve all the problems. And the metabolic side effects that they cause can sometimes add to the burden of the illness. So then we come to the second part of the presentation, which is what is it that we can do at patient level to increase, to decrease the severity of these side effects and to improve some of the outcomes that we discussed. So this is going to be the second part of the talk. So first up on slide 13, some of this will sound obvious because, well, we only have so many options ultimately to handle weight gain and related problems. And exercise figures right at the very top. Exercise, ideally a mix of cardio as well as weight training, but then any exercise is better than nothing. it helps in decreasing weight, it improves general fitness of the body. Exercise has been shown to improve brain functioning as well. So overall, exercise is a wonderful thing that all of us should do daily or almost daily, especially clients with mental illness who are put on these medications. They have to exercise 30 to 45 minutes every day just so that they are able to stay fit and manage and counteract the adverse effects that are sometimes seen with these medications. If you look at the next slide, slide 14, sometimes if it's difficult to get started, something as simple as a walk a day can get you on the path of physical activity, which can be useful in the long term. Sometimes when we ask clients to start exercising, they get bogged down by the enormity of the task sometimes. So it's sometimes easier to start with a smaller goal, a walk a day, a 15-minute walk, then gradually increase to a 30-minute walk. I mean, the weather is amazing now, and for the next 6 months, it's going to stay that way. So a half an hour to 45-minute walk can sometimes be the precursor to start regular exercising every day. Then we come to the next big aspect, which is nutrition. What we eat is what we become, and nutrition is important to our physical and mental health in multiple ways. If you see slide 16, more and more research now suggests that the food we eat influences these bacteria that reside in our gut, and these bacteria then have the ability to affect what happens in our mind. So there are studies that show that if you eat a certain kind of food, the mood becomes a certain way, and if you eat a certain different kind of food, the mood improves. So for example, high sugar diet or high carbs diet, examples would be, let's say, pop, or diet which is rich in takeout food like burgers and pizza, generally carbohydrate-rich items. They can lead to a worsening of mood, whereas food which is rich in probiotics, example would be yogurt, and then which is more fresh vegetables and fresh fruits, can be mood uplifting. And this is something that research is an area of active research. But having said that, one thing that is becoming clearer more and more is that if there's a lot of sugar in your diet, it might be worthwhile to cut out the excess. And the obvious culprits here are the hundreds of brands of pop and energy drinks that are out there. Even fruit juice, which is branded and marketed as healthy, is sometimes is tricky, because even if you were to consume, let's say, 100% juice, which is natural and organic and whatnot, a glass of juice, a standard serving, contains the sugar equivalent of as much as 4 oranges. Now, when was the last time you sat down and had 4 oranges in like 10 or 15 minutes? And that is the amount of sugar that you end up ingesting if you were to you were to drink juice. On the other hand, if you were to consume an orange directly, the max you would do is an orange at one sitting, and that cuts down the amount of sugar you're having significantly. So those are some of the strategies that can then be used to reduce the sugar intake. If you come to slide 18, there is also an economic argument to be made to a healthier home-based cooking, because if an equivalent amount of calories are consumed in the market versus being bought and made themselves, the cost works out to about a third. Independent economic analyses have shown that if a household cooks for itself for most of the meals cost work out to be about $1 to $2 per adult per meal per adult per meal. And if you eat out, it's unlikely that a fulfilling meal can be found for less than $5 to $10. And this is if you're hunting bargains. Otherwise, it can be much costlier. So there's a strong economic argument to be made for eating in as well. The quality of the food and the nutritional quality that is on offer is obviously another significant advantage that you achieve by eating in-house rather than eating outside. So it's a good strategy to consider becoming your own chef. And this link here, budgetbites.com, has several useful recipes that can be made on a budget. because we realize sometimes our clients are, sometimes, doesn't apply to all clients, but they are sometimes on a budget, and cooking, eating healthy can sometimes seem difficult, but then if somebody tries to make them at home, this is much more achievable than eating outside. The next big aspect is sleep. Getting 7 to 8 hours of sleep is essential, and often in our busy lives, which are full of activity and stress and there's so many things to do, we lose out on this significant determinant of health. Now, sleep is important because it resets our body systems, our metabolic systems, things like insulin levels, etc. Our bodies have this cyclical pattern, which is called the circadian rhythm. And several of our body processes start when we wake up, and then they tend to, and it's morning, and then they tend to go down as the day progresses into evening and night. And then if we are not able to get 7 to 8 hours of sleep during the evening, some of these cyclical processes are thrown off gear and off sync, and that causes metabolic problems. It has been seen that people who stay up later at night, who end up eating late at night, or people for whom this is a part of their work life, shift workers, etc., they have a lot more of these weight-related and cholesterol-related problems than people who are able to live a more regulated and regular lifestyle with 7 to 8 hours of sleep at the right time of the day. So sleep is a very important commodity, not just for mental well-being, but also for physical well-being. So all in all, what I'm trying to get at are these foundational habits, which are very important, if you see in slide 21, to build up the higher effects in life. So if you ensure that you're sleeping well, that nutrition is taken care of, that fitness is taken care of, other things such as higher brain function, better mental health, and longer lifespan sort of build up on that as those activities as base and foundation. And unless those three aspects are taken care of, it is unlikely that these higher effects will be stable. And over long term, it will lead to problems, as is seen with many people who are not able to follow some of these strategies. I'm just briefly going to touch upon some of the initiatives we have here at CAMH to help achieve some of these objectives. So as I mentioned earlier, sometimes there is a separation between physical and mental health in our system, which makes it difficult for one to access both aspects simultaneously. And here at CAMH, we have started something called the Collaborative Metabolic Clinic, where we are able to provide both of these services to some of our clients who are not able to access them and fall through the cracks in our system. And we are assisted here by a family physician, so family physicians and psychiatrists sit together to handle both physical and mental health together. So that's just a brief description of what we are able to do here at CAMH. If you move to slide 25, we also have research studies which look at some of these medications which can help reduce weight gain and associated glucose problems, because nutrition and exercise are two parts of a three-part program, and the third part would be medications. And in the subsequent slides, I'll discuss some of these medications and what can be done. So overall, to summarize the talk in slide 26, I'm sorry the number is hidden. To summarize, what one should do as someone who is experiencing mental illness is to be proactive, and with the psychiatrist decide what drugs need to be started. And together, the system should work to avoid drugs that are more likely to cause metabolic side effects when treatments are initiated, especially because people who are experiencing their first episode of illness are at highest risk for this, and irrespective of what medications used, they are likely to become better. So it's probably best to use the agents which have the lowest metabolic risk. So this table here on slide 27 describes the kind of weight gain potential that some of these medications have. So in red, drugs in red have the highest weight gain potential. So these include drugs like clozapine, olanzapine, quetiapine, etc. And then drugs in orange are the ones with moderate weight gain potential. So these include risperidone. And then you have the green drugs, which have the least weight gain potential. And these include drugs like amisulpride, ziprasidone, etc. And there are antidepressants and mood stabilizers, likewise, which fall in each of these three categories. So it's a nice, this slide is a nice to have in that for both for practitioners as well as for clients, patients, you can together look at this chart and decide the benefits and costs of sort of being on one drug or the other. And choices, conscious choices can be made to be towards the bottom of this table rather than to the top of this table, unless there are pressing clinical issues which make it important to be on the top of the table. As I mentioned earlier, some patients just don't do well on certain drugs and therefore they need to be changed, and then you gradually move up the table. But other than that, as much as possible, we should try and stick to the lower end. Because we know that some of these drugs have potential weight-independent metabolic side effects, things like blood pressure, fasting glucose, cholesterol levels, they should be routinely assessed, irrespective of whether weight change happens or not. And these are something that medical professionals are trained to do, and they will do it as a part of the services they provide. These monitoring range from every 3 months to once a year, depending on what is being monitored. And this is something that is the psychiatrist and the family physician's responsibility. But clients can also be proactive in that, and they can work with their practitioners to ensure that these are done as indicated, so that abnormalities, if any, can be picked up as early as possible. So coming back to interventions, we have the diet and exercise interventions that we spoke about. That should be frontline. If smoking is an issue, that needs to be addressed, because smoking by itself can make all of these issues much worse. Anything with smoking is much worse than without it. So smoking cessation has to be targeted. We should optimize medication doses so that the lowest possible doses are being used, and if possible and clinically relevant, one can think of switching to a less weight loss promoting drug. I have to mention here that this needs to be done in close participation with the psychiatrist. At no point should drugs be randomly changed without medical supervision, because the consequences can sometimes be quite difficult to manage after. With respect to drugs which can help with weight loss, some of these drugs include metformin, which is an anti-diabetes agent which can lead to weight loss in patients who are on antipsychotics. Topiramate, like I discussed earlier, can also reduce weight. And there are some newer drugs which have come to the market recently, which are basically approved for diabetes, and one is for weight loss as well, which can then be tried. These are usually tried after the first 1 or 2 medications fail, because these are the new ones. And again, these options can be discussed with the psychiatrist and the family physician, and can be initiated as required, depending on whether the client meets threshold for medications to be started. Well, that's it. And if you have any questions, I'm glad to answer them.
You can speak to
it. I can speak. Okay, go ahead. Yeah, sorry.
I know it's confusing because you're reading.
Go ahead with your question, please. Okay. Oh, that's a very good question. Yes, extremes can be bad on both sides. Sleeping too little and sleeping too much are both could be bad. Initially, when some of these medications are started, they can cause sedation, and this is something that you get used to reasonably quickly, and then sleep becomes much more regular. If you're finding that even after several weeks of starting medications, you're sleeping, or you're still sleeping too much, then there might be, then perhaps strategies need to be put in place. Uh, there's something called sleep hygiene practices where right before going to sleep, you cut out all stimulation which is media based, such as television, laptops, phones, computers, etc., and then put them away. And an hour before sleep, you have sort of a routine where you take a bath, maybe, and read a book, maybe, and then go to sleep. And then try to get up at a fixed time every day. And if you think you're sleeping too much, you could probably reduce it by 15 minutes to half an hour every week, and then try to bring yourself down so that you're within about 7 to 9 hours. Uh, Now, a qualifier here is whether you used to sleep more even before you were on these medications or only after. If you were a long sleeper even before, then that is something that is those are individual personality makeup. Some people sleep more, some people sleep less. But then if you're finding that a lot of changes happened after the illness and the medication, then this could be one of the ways in which you could try working on it. I hope I answered your question. Of course, please go ahead. Right. So that is a very good question, and that's a complex question actually. So I can give you general guidelines. This is not really my domain. I'm trained as a psychiatrist and not as a physical trainer. Uh, there are certain general guidelines that one can follow. Some exercise is better than no exercise, so that's one. If you can exercise, if you are able to exercise every day, then it is okay to take a break on weekends. That's fine. If that ensures that you're exercising every day on the weekday, then by all means, you should be exercising at least 5 days a week. With respect to cardio versus weight training, ideally you would like a mix. More recent research suggests that weight training might be more efficient at fat loss and building muscle mass, etc. And then you can build cardio with it. So, for example, you can warm down and cool off using a cardio-based regimen, and in the bulk of your exercise, then time is then spent on weight training. But then everybody has potentially can have limitations, right? Not weight training is not for everyone. So if it works for you, great, do that. If it doesn't, then it's not that cardio doesn't work at all. It's just slightly, perhaps, less efficient than weight training. So a balanced combination would be best. But if you're able to do weight training, great. If you're not able to, then cardio is good as well. So don't sweat about exactly what you're doing if you're starting out. Develop a routine, and then that can be changed as you go on. If you're already doing it every day, congratulations, first of all, that's a big achievement. And then you can speak to personal trainers, or you can you can look up books that talk about exercise. But then the general recommendation is to have a mix of both cardio and weight training. Oh, perfect. Thank you very much. Thanks for participating. Uh,
All right, and we're gonna just letting you know that we're gonna try to do webinars bi-weekly. So what you can do is just continue to look on the platform if there's any new webinars, and if you're interested, please join it, and we'll continue doing it. And I hope you enjoy today's webinar.
Yep.
Thank you so much for joining.
Thank you. Bye.
Bye.